Okay, let's introduce ourselves. Shall I
All right.
start?
Yeah.
Well, I'm Floor. I am 23 years old. I'm from the Netherlands, from Zwolle. And I'm in second year of nursing school. And you?
I'm Demi, I'm 22 years old, also from the Netherlands, from Hardenberg, nearby Zwolle, and I'm also in second year of my nursing school.
All right, I'll go. So I'm Amber. I'm from Shakopee, Minnesota, which is in the United States, and I am finishing up my final semester of nursing school. Graduate in 1 month from today.
Nice.
Oh, that's terrifying. All right. I'm Natalie. I am 22. I am from Minnesota, which is the United States of America. And I am also a senior nursing student set to graduate a month from today, apparently. So our topic of discussion was about families in crisis, specifically those dealing with depression and substance abuse. So previously we talked more in depth about the similarities and differences of mental health and the healthcare systems in the Netherlands versus the United States. So Amber and I are going to talk first a little bit about what we found for our topic. So Amber, do you want to start?
Sure. So basically, there's we decided there is a taboo around the topic of depression, but it is becoming more known with bringing awareness to it. And specifically in the United States, if you're feeling depressed, you can go to the doctor and they will they have different assessment tools you can use to kind of diagnose yourself or for them to diagnose you, and then from there you can talk about different therapy options along with pharmacological interventions.
So we did like some research, and some of the articles we found that were like revolved around families. Here in America, it's a lot of it in the healthcare system has to do with prevention, but we also talked about how there's like a generational gap with the older populations and how they grew up during a time that mental health wasn't really addressed. And like Amber said, it's becoming more prevalent and talked about and acknowledged as seeking help, but there's still that difficulty for people to speak up and get psychiatric help or help with substance abuse because it doesn't often present with physical symptoms as if you were sick going to a primary care provider. So yeah, we just found some articles on like ways that nursing interventions could help with this. Like Amber said, there's assessments for that in the hospital, but also just if you're in a family care clinic, identifying like ineffective coping or signs of alcohol abuse or mental health issues, and figuring out how to find treatment or help these families. And then, yeah, one of the other main things was our healthcare system. It's often hard for people that can't afford healthcare coverage to seek psychiatry or therapy because it's so expensive. Mm-hmm. So there's definitely a issue in that sense for getting treatment or help.
Yeah, and relating it to substance abuse, I found a statistic that said mental health disorder patients are responsible for 38% of alcohol consumption in the United States. So that's like a wide range of mental health disorder, but it just like shows that like the correlation between the two. Like alcohol is a depressant, and like almost half of the people consuming alcohol in the United States have some sort of mental health disorder. So the symptoms of one disorder tend to trigger symptoms of another.
Yeah.
Mm-hmm. All right, you guys go.
Okay.
Yeah, well, we also looked in like the care system in the Netherlands. Well, over here, we all got insured for health issues, healthcare. When you got depressive feelings, you can go to a doctor and he will send you to a psychiatrist. Or if you are a danger for yourself or somebody else, you can be placed in a psychiatric facility.
Mm-hmm.
And there are a lot of laws, different laws that will make that happen. We got like 5 different laws that do say things over the forced placements, forced medication, separation, isolation, everything like that.
Yeah. So they can help you even if you think you don't need it.
Yeah, and also we found in an article that 1 out of 4 people with a depression also has a abuse of alcohol or drugs. But also our article says that 23% of all abusers of alcohol or drugs get a depression, and that 18% of all depressive people going to use alcohol or drugs or anything like that. Nog meer.
And also, like you guys said, in the US, here in the Netherlands, there's a big taboo on it. And we also found a guideline. I don't know if that's the correct translation. And about double diagnose. So if you have a depression and alcohol abuse, what to do with that, because you can't just work on one. You need to work on both.
Yes. In the guideline, it also says that you first have to treat the abuse before you can treat the depression.
Yeah. Mm-hmm. And what do we need to say more?
We also think that as a nurse, you have to include the families of the mental ill patients, so they can understand what's going on and what they can do or what they can't do, and to explain that it's not their fault, but other different things. I think that's kind of it.
Yeah.
So
they're pretty, I think they're pretty similar in both countries. The only main difference is that our healthcare systems are different, and here it's more expensive to get help that we need. But
if you need help, is you can get help if you need it. That's maybe the common part.
In the Netherlands, everybody gets the care that they deserve. If they're rich, if they're poor,
it doesn't matter.
It doesn't matter, basically.
So I feel like in conclusion,
in both countries there's a taboo on mental illness.
That's what I was gonna say. And the that it's becoming more talked about
Yep.
and acknowledged and normalized in both places, which is good. And just that there is that gap, generational gap. And as future nurses, I feel like it's important that we're educated on mental health and substance abuse and knowing
And
how to empathize.
symptoms.
Yeah. So yeah, and I
Like
feel like after our
as like a physical problem, like
mhm.
Yeah.
Take mental health as serious as
Yeah.
physical health.
Yeah.
And I feel like after all of our previous like personal story sharing, like we're able to all empathize in this type of crisis because we all have a unique situation that we've personally dealt with. So that helps us as we enter our nursing practice.
Yeah. Well, that's a good end, I guess.
All right.
Yeah?
Good work, team.
Yay! I will stop recording now.
Okay.